My name is Wayland and I'm the Senior Resident Superior Court Judge for Beaufort County, and I'm very concerned about the opioid crisis here in Beaufort County. As a Superior Court Judge, I see the effects of opioid addiction on individuals and families. Opioid addiction has skyrocketed. It's estimated that it has increased more than 500% in the last 6 years alone. As a matter of fact, 75 to 80% of all our Superior Court criminal cases now are affected in some manner by opioid addiction, whether it's direct sales of these drugs, people selling their opioids that they have received through prescriptions, larcenies, breaking and entering of motor vehicles, or other crimes. It affects everyone. There is no socioeconomic difference in opioid users. They could be your next door neighbor, your friends from high school that all of a sudden you hear they have had trouble or even died from opioid addiction, or they could be in your own family, and many times are. We must have a community conversation about the identification of opioid users and such that we can get them immediate help and try to stop their addiction from becoming a long-term problem. Treatment alternatives from a short-term nature don't work. An opioid user will try to get drugs any way they can, and the only way to break that chain is long-term inpatient treatment, which I strive to give the people that come before me. But we have to have the resources to do that, and the community and our state need to dedicate the money and the time and the people and personnel to get this done. As your Superior Court Judge, Wayland Sermons is committed to being a part of the solution to the opioid crisis.
This crisis is destroying the very fabric of the families here in Beaufort County. And now, with the introduction of the synthetic fentanyl, which is 50 to 100 times stronger than morphine, these overdoses are resulting in deaths. As many as 3 people every day are dying in North Carolina as a result of this epidemic. Education to the young folks is key in the battle against this crisis. All branches of government, including the medical community, must collaborate to fight this crisis. It's all for one and one for all. As your district attorney, Seth Edwards will be a part of the solution.
I'm Frankie Waters, Chairman of the Beaufort County Board of Commission. I'd like to talk with you concerning the impact of the opioid drug problem within Beaufort County. It causes an increase in the EMS calls and an increase in our emergency room visits. It increases the loss of days from our students in school. It lowers our productivity at our jobs. It's a misuse of our jail facility. It causes broken families. It increases the need for foster care parents within the county. And last but not least, it's an increase in our crime. It affects all of us, children, adults, seniors, all races, males, females. There is no boundaries. The solution is to reduce the use of prescription drugs and to reduce that supply chain that's within our home. It's also to eliminate drug shopping. And also, we need to stop the sale of illegal drugs. We need to educate our parents and our grandparents, increase our treatment programs for those that are affected because this is a disease. We need to love that person and express hope. We need to reach out and be part of the solution. I, Frankie Waters, Chairman of the Beaufort County Board of Commissioners, express to you my commitment to make a difference in Beaufort County as it relates to opioid drugs.
My name is Lisa Gibbs Lee. I'm one of the child welfare supervisors at Beaufort County Department of Social Services. On the child welfare side, we have certainly seen an increase in the number of reports related to children that are affected by substance abuse and specifically related to opioids. And looking at the number of children in care for our last fiscal year, of the 100 children in care, about 50% of those cases are directly related to substance abuse, specifically related to increase in opioid use. On the adult services side, they also are seeing an increase in reports related to elderly adults or mentally or physically disabled adults. One of the issues that they're seeing are elderly or disabled persons who need care. Their caregivers or their children or grandchildren are actually using their prescription medications. An increase in foster care numbers, an increase in reports, an increase in services that we're providing really directly impacts the cost to Beaufort County citizens and taxpayers. I'm Lisa Gibbs Lee with the Department of Social Services, and we are committed to helping find a solution to the opioid crisis in Beaufort County.
Hello, I'm Don Phipps, the superintendent with the Beaufort County Schools. And I want to share with you my experiences professionally from the standpoint of the opioid use and epidemic that we hear so much about. I am certainly aware that there's a crisis going on across the country as well as across our state. My goal would be that we would be involved and be a partner with all those who have an interest in finding a solution. I'm Don Phipps, and as a local superintendent, I'm committed to being a part of the solution of the opioid crisis in Beaufort County.
Hi, I'm Jim Madson, Beaufort County Health Director. I first became aware of the issue with opioids with our last community health assessment, where I saw a 400% increase in hospital admissions due to substance abuses. Most people are surprised to find that the age group that's affected the most is the 30 to 49-year-olds. In Beaufort County, all ages, all races, and all sexes are impacted equally. I think there are three things that we can do to tackle the situation in our county. One is we can reduce the number of pills in our community. Secondly, we need to tackle the abuse issue through either treatment and or education. Lastly, we need to work with law enforcement to reduce the illegal drug in our county. I'm Jim Madson, Health Director. I'm committed to being a part of the solution to the opioid crisis in Beaufort County.